Want to know when to use hot and cold therapy? Well, let's talk about it.
Disclaimer alert, disclaimer alert.
So generally when you're using hot and cold therapy, there are some exceptions to the general rules, but I'm just going to kind of talk to you about generally how you'd use the hot, generally how you'd use the cold, and how I would use it in a setting. So we'll talk about hot therapy first. And today I'm going to be using the MedVice reusable hot and cold pack. And if you're interested in purchasing it, you can click on the link up there. So starting off with hot or heat, it's important to know that a lot of times, even though they're called hot packs, when you're doing hot therapy, you really want to aim for warm. You don't want it to be so hot where it's uncomfortable. If you're trying to loosen up muscles or relax, you want it to be warm to the touch, so not super hot. And I think a lot of times people get confused with that. They're like, you know, I want it to be really, really hot, but you just want it to be warm so it's a nice soothing feeling. So when you're doing hot therapy, this is really to increase circulation, increase blood flow to an area, to help warm it up or make muscles more flexible. So I like to use hot therapy before you do stretches and exercises, or before you're going out to do a workout or play in a game, because that will help loosen up muscles, especially if you have an injury and sometimes stretching is a little harder to do or a little more uncomfortable to do. So for example, if I had a hamstring injury, and I had heated up my hot pack, I could just set it here and start loosening up the area. 15 to 20 minutes would be really good if you're then gonna go do something afterwards. That's a nice warm up amount. But if you wanna use it for something more chronic, like arthritis, you could have it on for a little bit longer with the heat. Again, you want it to be more of that warm than hot. But so for heat, it could be anywhere from 15 minutes up to an hour of using it. There are some precautions with heat therapy, so make sure you're talking to your doctor or physical therapist of, is it okay to use some things like diabetes, because there's circulation issues sometimes that you don't want to use it for that. Also, like if you have a DVT or issue of DVTs, the deep vein thrombosis, you definitely want to check before you use something like that. And then even MS, a lot of times with MS, using heat actually kind of increases the symptoms. So just make sure you know when you're using heat and when it's appropriate for you. So always make sure you're checking before that. And so it's really nice because these kind of mold to the area. So let's say I have some knee arthritis, I'm kind of stiff, I want to loosen everything up. It's a nice way to just kind of wrap it around if you want to. So that works really well, especially with these gel packs. You want to be careful where it's warm and not hot. So I always do recommend having a buffer in between either your clothing or a towel or something, just so you're not having that direct contact on there. So then if you want to go into cold therapy, you stick it in the freezer and then you have it nice and cold for your gel pack. So cold therapy is a little bit different. It can sometimes be used either or with heat therapy, but in general with cold therapy, this is more now to reduce the circulation or reduce the blood flow. And the reason that you might want to do that is if you have swelling or inflammation, that cold therapy will help kind of calm everything back down. It also, a lot of times with cold therapy, therapists will use it in a situation to reduce pain because it kind of, like for nerve pain and stuff, it will calm everything down and then you're not feeling that nerve pain or the pain from the swelling and inflammation for a while. So it kind of slows everything back down. So generally I would say this is what you do after your workout or after your stretches and exercises. Maybe you've gotten everything going and maybe your injury is just a little bit irritated now and you've got some inflammation in it and you want to calm it back down. There's a lot of research out there of should you calm back down that inflammation. You know, inflammation is good, it's there for a reason. Well, it is, but if you have too much inflammation, that can cause scarring or adhesions in the tissue, and that can actually cause more damage or imbalances in the muscle in the future. So you want to have that happy medium of sometimes inflammation is okay, but too much inflammation is actually bad and can damage the tissue. So again, this is something to definitely talk to your doctor or physical therapist about. is this right for me? Should I use it? And again, with cold therapy, there also are some precautions for it. Again, with things that if you have like poor circulation, you don't want to make it even more poor circulation with the cold therapy. So, if you have, again, things like diabetes, this is something you really want to check with first because your circulation's already bad. Vascular disease, you don't want to slow things down when they're already slowed down. So make sure you're checking with those things. A little bit different with the ice or cold therapy. It can be ice, it can be cold. You definitely don't want to do it directly on your skin. So you want to have that towel barrier or your clothes barrier. The only exception would maybe be if you're doing an ice massage and then you are doing it directly to the skin, but you're only doing it for a few minutes versus with a cold pack, you can go up to 15 to 20 minutes. I usually say I really like more the 10 to 15, but once you go more into 20 minutes, then you're really slowing things down too much. And sometimes what can happen is your body can go into protection mode. It actually thinks you're going into hypothermia and it'll start warming the area back up. So you're kind of being counterproductive. So I would say 10 to 15 minutes, 20 minutes at max. You don't really want to do too much more than that. But this is great, especially if you have an immediate injury. Like, let's say, I twisted my ankle, I was running, or I stepped off a curb, and you see that immediate swelling. That's good when you want to get that cold therapy right in there right away. So you can also use it for other things like arthritis or chronic pain issues. So once you go into that chronic stage, it's really hot and cold is what you like the best. It's not necessarily you need it for this or you need it for this, but when it's an acute, like when it's just happened, that's when, okay, I've got the swelling and inflammation. I want the ice on there or the cold on there to start off with. And then if I'm doing my stretches and exercises a week or so later, then the heat can kind of help loosen up those muscles and get them warmed up and get them going before you start. And then the cold is to calm everything back down afterwards. I know, yeah. So that's when and how to use hot and cold therapy. If you're interested in purchasing the MedVice reusable hot and cold pack, click on the link up there. And remember, be safe, have fun, and I hope you feel better soon.